Just walking along a level road, I got the most agonising pain.
What cancer in the family is there?
It's the bowel and stomach cancer.
Yeah.
I've lost my mum, my aunt, my two sisters.
We do need to investigate this.
The stitches have to come out.
Right. Well, let's just get it over with then.
No.
Sammy, look at me.
No.
You'll feel like a pinch.
Oh my gosh. I'm never having sex ever again.
I'm so sick of me. So sick of me.
Hello, how are you?
Have you had a letter?
I've got a letter.
From Chelsea in Westminster?
Yes.
Oh, right. Well, you know, I came to see you, I think it must be 3 weeks ago, right? With something wrong with my abdomen.
Yes.
Well, a couple of days after I saw you, I was walking up a steep road and I got a pain right in the groin between the leg and the abdomen. Stabbing pain. And about 4 days later, just walking along a level road, I got the most agonising pain across my abdomen and into the groin.
Yes.
I've never felt so much pain in my life. And I limped along the few hundred yards back to the car.
Yes.
And once I was sitting in the car, it went away. Oh, crikey.
It's coming.
The pain in my...
Let's have a quick look. Can I get you
Well,
here?
I'm wondering whether you'd be better off to look at me stood up, actually.
Yeah, that's fine.
I can feel a bulge here. In fact, it's there now.
Where's this lump swelling?
Well, if you press there, can you feel...
So this is what you
That's a hard lump.
yeah.
That never used to be there.
That's a clear hernia.
Right.
Let's get you on here.
Right. One.
Oh yeah, no, it's gone. It's gone. Have a feel there. Can you see?
Oh, for God's sake.
So it is a hernia. It's a clear hernia.
Okay. God, what?
Chester, let's talk about that. A hernia is where there's an outpouching of the bowel through the abdominal wall. So that's when they'll give you the severe pain.
Yeah,
when it comes
and
on.
when I'm walking.
And the key thing with that is
Yeah.
it will go as soon as the hernia goes in. Push that hernia back in.
What, I can just push?
Yes.
Literally?
Yes. What you want to do, if that severe pain comes on, is lie down first
and
of
press.
all, and then push it in.
Yeah.
So what you do is you push it towards your centre.
Right, okay.
Yeah. So you push it this
Okay,
way.
right, okay.
And it will go in, and the pain will go.
Right,
And that's
okay.
the hernia pain. So we'll
Right.
need to refer you for that, for a hernia repair.
Yes, okay. God. I'm having a really bad year.
It's useful to be able to get a patient to a place where they can manage their medical problem, not necessarily curing it, but they know what it is, they know what to do with it. I'll do the referral, so pop in on Thursday this week.
And get the letter from here?
Yeah.
Okay, I'll come in the afternoon if that's all right.
Yeah, no problem. All right.
Thank you very much.
No problem.
Dr. Sharp.
Yeah.
Okay, bye.
See you.
She's seeing a patient, then she's got... Oh no, she's just finished seeing a patient. She's going to see another one, then you'll be next.
This is Kim, who'll be looking after you.
We did.
Yeah.
Hi, how are you?
In you come. Take a seat.
I'm a bit nervous for this, honest.
I know, don't worry. Everyone is when they come for this,
Yeah.
but it will be fine. It's a good choice.
Yeah.
I'll have to sit here for a minute and tell you everything that can go wrong with a coil, but that's all really rare.
Yeah.
Although it's one of the better forms of contraception in the market, you can get pregnant with a coil.
Okay.
And if you do get pregnant with a coil, you're more likely to have an ectopic pregnancy, essentially outside of the womb. If that happens, that's, you know, an emergency. You need to go to hospital, you lose that pregnancy. At the time of insertion of a coil, it's possible to perforate the womb with a coil. It's rare. And
Has that ever happened to you before?
Yes.
Oh, no.
But I've been doing these coils for 20 years almost, so it was always going to happen if you've been doing it this long, but it's rare that it happened.
Okay.
Infections, a coil in itself won't cause an infection, but it can make, for instance, if you were to catch chlamydia, the fact that you've got a coil in there might make that a worse infection. Okay, so use your condoms, please, even though you won't need them for contraception. So when was your last period?
It finished like over a week ago.
And from the day it started to today, have you had any sex at all?
No.
You've had no sex? Wonderful. That's what I want to hear.
What was wrong with you?
No, that's good news, because I need to make sure that there's no chance you'd be pregnant. And the summary is, if any pain, anything a bit strange with the coil, come and see us straight away so we can check you. All right, so if you're ready, go ahead.
So what I need you to do is, if you're happy, pull your dress up, take your undies and everything off.
So at any point, if you want me to stop, please just say so.
Can I take your date of birth?
Okay, what's the name?
So when you sort of say you're having lots of pain in the stomach, it's just pain, or is there a change in the bowels, some diarrhoea or something like that?
No change in the bowels, no vomiting, a lot of burbling and flatulence, both ends.
Yeah, it sounds a little bit like indigestion.
It's the one I have to keep burping.
Burping.
To like, and it's not even proper burping, it's literally just trying to squeeze a lot of trapped air, trapped wind. It's all very, very embarrassing.
My metabolism used to be very, very quick. Now it's every 2 days, every 3 days.
Okay.
You know, and I feel really bloated and big and uncomfortable and all them kind of things, which I've never had before.
When I have like fizzy pop, I burp straight, not burp, but it feels like a burp. It forced sort of comes out, and I just don't know what it is.
It's unlikely to be anything significant. It just depends on how much it's bothering you, really.
Right.
When I get bloated, obviously, I get pain because I'm bloated. And the thing is, I give a huge burp and I feel so relieved. It's so good. 5 minutes later, I'm bloated again. I'm not eating, I'm not drinking, and it's continuously filling, and I need to burp. If I don't burp, I feel bad. I feel nauseated. I can't eat whilst I have that. So the day or the days I've got that, I barely eat because I'm feeling unwell, and then I don't know, am I hungry or am I just sick? Then if I do try to eat, I get worse. So I'd rather just not eat.
Does it get better when you go for a poo or pass wind or anything? Or?
Yeah, it releases I get relieved for a short period of time, and then it restarts again. And it's the entire day.
Okay.
I am on this the entire day.
Shall we have a look at you first, and then I'll make some suggestions about what could be going on and things like that. So, I'll just go and need to feel your tummy basically. So what I'll do is I'll just pop you up on here. That's great. And do you get any pain in your tummy?
When it's bloated, seriously bloated, yes, but apart from that, no. And I don't see any difference with my feces either.
Okay. So no blood or anything in the stool?
I don't think so.
No.
I don't think so.
No weight loss or anything like that?
No, unfortunately, no.
You can hear, almost feel the gurgle there. Big breath in and out. I'm just going to get my stethoscope and have a little listen to you.
Yes, I always have air there somewhere. But when I do get those episodes, it's a lot.
Okay, that's great. You can put yourself back together again, and then we'll... your symptoms are quite sort of consistent a little bit with irritable bowel syndrome. The problem is you've probably not really had them long enough to sort of like make a diagnosis of that. Plus, irritable bowel syndrome tends to be this sort of like a chronic thing, and yours sounds much more you know, a little bit more acute. I think what would be the best way forward is maybe to do a few tests just to sort of exclude, one, that you've got any kind of ongoing infection, so that'd be a stool sample. The other thing that we'll check for is celiac disease, which I don't know if you've come across that. That can give these kind
not. I've got a friend who's celiac, and I love my bread.
No, I think all of this is probably
and it's
unlikely.
Completely unspecific for food. It doesn't really matter what I eat.
No, I think it's all probably unlikely. I suspect you've had a reaction in your gut and it needs to settle down, and these can go on a while. So the other thing to try as well is to maybe try and keep a food diary with what you've eaten and what symptoms you're getting, and see if you can identify a pattern. Then if you do sort of identify a pattern, you can maybe start trying to take certain things out of the diet and seeing if that helps with your symptoms.
Sorry about that.
Appointment to see Dr. Watson.
Dr. Watson, and your name, please?
Angela Richardson. Right,
That's fine, just take a seat for me.
Thanks.
You're welcome.
Pop that and then give it back to me.
Is it going in now?
No, not quite yet. We'll go. So I'm just going to get hold of the neck of the womb now. You'll feel like a pink.
Just relax. Put yourself on the beach. Think of the birds above you, sea lapping, glass of wine in your hand.
Yeah, of course.
Breathe slowly.
Oh, yeah, you're
It's
doing
fine,
brilliantly.
it's fine.
We're nearly there,
Honestly,
Kim. Kim,
it's
can I
fine.
have the coil?
Yep.
Oh, that wasn't the coil.
No, I was measuring your womb. We're nearly there now, Felicity. Inserting coils is quite a common procedure done in primary care. The Mirena coil will make your periods lighter, and 40 to 60% of women end up not having periods. You've done absolutely brilliantly. The Mirena coil can also be used for treatment of heavy and painful periods.
God.
It's okay. It's okay. It's okay.
Oh, God.
It's okay.
It's all finished and you've done brilliantly.
That's it.
We're finished now.
It's all right. All right.
Oh my gosh.
Okay.
Never having sex ever again. Oh, that's terrible. Imagine I'm writing childbirth like this now.
But it's all over now and it's...
Okay.
You did really, really well.
I don't think I did very well.
You did. I think it's really common when you do intrauterine procedures in the womb that the womb contract and that cause an unpleasant, crampy, horrible pain when you're inserting the coil because the neck of the womb tightens up and it doesn't like it. You did really well.
Okay.
All right. You okay?
Yeah, fine.
The patient was in, I'd say, a bit more discomfort than average, but that settled pretty quickly, which is often the case. I hope, women would find that reassuring. So before you rely on this for contraception, you need to feel your threads. The coil is up there in the top bit of the womb, and the threads hang out into the vagina like that. So with your middle finger, you go up and back, and you come across the neck of the womb that feels a bit like the tip of the nose with a dimple in the middle.
Yeah.
And you'll feel the threads either just hanging or sometimes with the warmth of the body, they curl around the neck of the womb like that.
Yeah.
Once you feel the threads, you know that the coil is up there.
Yeah.
And then you can rely on it for contraception, okay? And so this coil will last, Felicity, for 5 years, all right?
Definitely not. Brilliant.
Okay.
Thank you very much.
All right then. Take
care.
care.
Bye.
Bye-bye.
Right. What's on the agenda for today?
I had a drunken incident at the weekend and smashed my leg, and at the time I thought nothing of it, but I looked at it and it just looks horrific, basically.
What happened?
Oh, I just fell backwards and smashed it on a corner of a really sharp table.
How much did you have to drink?
Quite a bit.
Beers or shots? Or
No, just beers. Yeah,
how many beers when you drink heavily?
Well, I don't know, 5 or 6, I suppose. Yeah. It's not. I haven't been doing it that often. It's only just a one-off.
Can you pop your hand out in front of you? We'll see how you're going. So I think you were a little bit shaky last time.
I've had that for quite some years, and I've been in previously about it and had blood tests, and my doctor say just cut your caffeine out. But
Because I know that we've spoken about alcohol use here before.
Yes.
Your liver tests were a bit off before.
Yeah.
Let's have a look at your leg then. In terms of the drinking thing, we've got to try and get your liver test down to normal.
Okay.
Because having not normal liver tests is a problem.
Yeah. I'm going to be going out and having a little drink every now and then, but I've just not been going that nuts.
Oh, yeah.
Yeah, doesn't look very nice.
No, it doesn't.
But I'm not sure that's got even bigger, it's just that bit was concerning.
I'm just feeling for a haematoma under the skin. Sometimes you can get a big area of fluid under the skin, but I can't feel anything there. I think that will heal up really nicely.
Oh, good.
So I think you'll be fine.
Yeah, just peace of mind.
Yeah, have a seat. So let's make a plan then about your liver. So we did your tests in April, and 2 of the liver tests were elevated. And that one was 118, which is just about double the normal.
Okay.
And that one was 93, which is about 50% over normal.
Okay.
We're an amazing surgery.
Yeah, we are. I might even move here, Andrea. I can't. PT is like more than
15 minutes. Message the doctor and say, are you able to see them? Now, what I do with patients is I say to them, take a seat there so that I don't forget you. Because if they go in there,
you'll forget.
They're still a D, that the doctor doesn't know that they're here and they could get overlooked.
How many beers when you drink heavily?
Well, about 5 or 6, I suppose.
So what's an average week over the last year in terms of ales?
I never binge drink. I never drink loads in one day, but it's just every day almost, having your day off here and there.
So that's why your liver was stressed?
Yeah.
And it's still a bit stressed?
Yeah.
The real worry would be that eventually you ended up in liver failure, and that could be a really, that's life-threatening.
Yeah.
And obviously we don't want you to end up in that situation.
I'm happy I can just cut beer out. I really don't think I've got an issue in that aspect. I can just cut it out, no problem.
It is commonly the case that we we know that lifestyle behaviours represent a much bigger threat to somebody's health than they sometimes realise at the time. And when you're trying to motivate somebody to make behavioural changes, you want to move somebody from one step to the next. And if you can achieve that, that's a very significant achievement. I think maybe there's a clear target then, which is to have the bloods done in another month.
Okay.
And then we hope that they've come down to completely normal.
Yeah.
Which they should do if you've almost completely stopped.
Yeah.
Does that sound all right?
Yeah, no, definitely.
So I'll give you another blood test form, and you perhaps have a blood test in another month or so. And then perhaps I'll see you a few days afterwards.
Yeah, excellent.
All right. Okay, good to meet you.
So, see you later.
Take care, bye-bye.
Angela, hi.
Hi.
How are you?
I'm okay.
Good.
Yes, right. How are you? Are you okay?
I'm fine, yeah. Thank you.
Fresh.
Thank you.
Yeah.
So, last time I saw you, we were talking about your blood pressure was one of the main things.
Yeah, it was. Yeah. I mean, funny enough, I forgot to take it today, but I have been taking them since.
Since you saw me, okay. Any particular reason today that you forgot, or just?
I just kind of, I don't know, I just ain't been myself lately, at all.
Okay.
So.
In what way? What's been happening?
I'd probably say the drink more, you know? Yeah, and I just don't even know. Everything annoys me. People annoy me.
And have you been drinking on other days as well, other than... So yesterday you're saying you were drinking to try and cope with this?
I just drink generally, every day.
Do you?
Yeah, every single day. Every single day. I get the shakes, In the
morning?
Not always, but sometimes. And I'm literally holding a can like that to drink it. you know.
And we haven't really talked much in the past about alcohol and drinking.
I never really thought it was a problem, but obviously it is.
Okay.
It's like, it's not even to say I'm replacing one with the other, because I'm still doing the other.
Okay.
Yeah, but it's just, everything just annoys me.
Okay.
Everything I take is not making me happy, you know. You're supposed to take stuff to make you feel better, or high, or happy. And it just makes me feel like shit.
It can be overwhelming dealing with some patients who have many problems in their lives. I think we have to take a step back and remember we cannot solve every problem. We're not there to solve every problem, but we need to try and address and help in any small or large areas that we can. Often it's a role of signposting and directing people to other support services where that help can be given. Are you still under IDAS? You were saying last time
Do you know what? I haven't been for ages because I needed to just breathe, but I've let everything go.
Okay. I mean, I think you need to go back.
I do. But when I'm not being shown, I don't want to leave. I just want to stay in all the time. You know what I mean?
Okay.
I don't want to see anybody. I don't want to go out. I just want to stay in.
But from what you're telling me, you're not happy at the situation. You're not happy at your behaviour and what you're doing. It's not making you feel good.
No,
and we need to find a way to change it.
Yeah, it's just annoying. I'm so sick of me. I'm so sick of me.
Why is he crying? I don't know, maybe he's just a bit sad.
Has she ever had anything like this before?
Never.
What do you think's happened?
I don't know, you're the doctor.
That is true. That is true.
So running, jumping, climbing. Any worries there? She's very active girl. Are you an active girl? I can see you hiding.
Au revoir.
Okay.
Bye-bye.
So you've got a new valve, is that right? Good. Okay, and I think you've got a few stitches to come out, is that all right?
And the dressing off as well, please.
You'll be all right. Gosh, having had a great big operation like that.
You were very, very brave, I'd have to say.
Well done, you. So do you want to come and sit on my couch?
It was
There you are. You come up here, Sebastian. You lie on the couch, that's it. You can't be like that. Do you want to sit up a little bit more? You all right like that? Okay, so all I'm going to do first is take the dressing off, nothing horrid.
I want to go to Toft tomorrow.
No,
Tomorrow?
we'll just do
this. And if I say stop, you have to stop.
All right, it's a deal.
Deal.
Okay?
Let her go for it, okay?
I think if we do it quickly, it'd be much better.
Oh, look at that.
That's what I said.
It's halfway off already.
Good boy.
Look at that.
Woohoo!
That hurts. It's all
Sorry,
my neck.
I know. Let's just
And it's
Sorry.
off.
Sorry,
That is
Sebastian.
absolutely.
You don't really want to keep this, do you?
No.
No, I don't think so.
so. Well done, you.
Well done.
Oh, look at that. What a neat job.
So your actual scar is excellent. That'll fade to virtually nothing. You're right. Yeah, but it's squeamish. What's that?
What's the yellow part?
It's a little bit bruised around here because where they opened your chest, it's made a little bruise. It'll fade very quickly.
Right, let's
Can
go.
we take over those little ones?
Yep.
Do you want to do it?
I've wasted opportunities over the years and I've always completed detox just like, you know, literally like that. You know, I can always get over the drugs, but I never want to look at myself, the reasons behind the drug. So, I don't know, I'm
Okay.
stagnant.
It's not an easy, it's not an easy quick fix, but there's lots of different things there that I think if things are going to improve for you, I think one, you have to get to IDAS, and two, you have to tackle those issues.
I do indeed.
Let me call them now when you're here, and let's put on this to do your blood pressure and see how that is. Okay. Okay. Anywhere, just relaxed. Yeah. Okay. Yeah, hi there. My name's Dr. Watson. I'm calling on behalf of a patient, Angela Richardson, who's been trying to get some help from IAPT. Really just calling to see if we can try and set that up for her, please. Okay, I will do. Okay. He wants to speak to you. That's okay.
Hello? Yeah, hi. Okay.
Your blood pressure, I know you're multitasking, but is really high. I'm going to have to add in a second tablet because we're not getting anywhere with this amlodipine. I know it's been a bit hit and miss, but if you keep in that blood pressure, it's quite not very safe. So we're going to need to take this as well as amlodipine.
Yeah.
Okay? And then I've just booked an appointment.
Yeah, hi. Okay. All right, thanks, Nathaniel. Okay. Bye. Yeah, he wants to speak to you.
Hello? All right, thanks a lot. Bye, bye. Okay, so I've written the appointment on there, Wednesday, 10 a.m. I've booked an appointment, you'll get it through in your text message, it's next Thursday, so I can take your blood pressure again.
Okay.
It's, all I can say, it's really high, it's really important you find a way to take your tablets because there's a real risk of, you can have a stroke, you can have something bad that can happen with a high blood pressure. I'm not saying it to panic you, but you need to know you need to take your tablets.
Thank you, Doctor.
Okay, so I will see you a week on Thursday, and I can, it's up to you, but going to IDAS.
Yeah, and I will be at IDAS. Thank you, Doctor.
Yeah, okay, no problem. Bye.
I can't do it without touching you, Sebastian.
Right, off. Come on, because the nurse has got another... Darling, it's not fair on the other patient sitting outside out there, is it?
The stitches have to come out.
Right.
Well, let's just get it over with then.
Let's get it over with.
No.
Sammy, look at me.
No.
You're making it worse.
No.
Okay. Okay, let's go.
No. No.
No, it's not fair on the nurse now.
Please don't kick. Come on, you're too big to do that.
It's okay. I know, darling. I know. It's okay.
Peely
I'm not
paper
okay.
runs off. I'm sorry. Don't cry.
It's okay.
It's nearly off. It's nearly off. Just give me one more second. Good boy.
Did you look?
That's
Did you have
off.
the blood done?
Okay, I'm not going to do anything else. I'm just going to give it a little wipe. All right? Okay, look. You can see the stitch is nearly out, actually.
Right, it's nearly out.
I don't want you to move suddenly because to take the stitches out, I have to use a sharp thing.
Remember how clever
A stitch cutter to cut the knot. Okay, all it is like... It's not going to touch you, Sebastian.
Sebby, look at me. Look at... Sebby, look at me.
Okay.
Is the bottom going to touch me?
No. So I want you to look and talk to Mummy.
Look at me. Remember when we did the bloods before? When you did the bloods with Daddy? Remember I got lost? Because the sat-nav took me to Westminster, didn't it?
Did it?
And I was in a panic.
One's out.
And then we phoned Dad. And
Good
then we
boy.
got lost and then we parked and it's done.
That was all right, wasn't it?
That felt slightly bad, but I bet the middle one could be
Well,
worse.
we just don't know. Let's
The
roll with
middle,
it.
So that one
You're going to have to
next?
swap sides, aren't you?
Yes.
Okay, I'll
I
come
can
right
do
over
that.
this
We'll
way.
swap sides.
Scissors.
This nurse has got the patience.
We did all right then, didn't we, Sebastian?
Sit still. Sit. Look at me. Look at me. Look at me. Look at me. Remember when Daddy was there?
Yes.
And then he came. And how late was Daddy? Was Daddy late? Like he always is, huh?
Is he?
Went to the wrong place because we
Nearly
forgot.
out, it's nearly out,
We forgot.
Sebastian.
And then we had the chocolate milk. Do you remember?
There we are, that one's out, okay? We've only got one to do, we're nearly there.
Right, let's go.
Last one, we're
Listen,
nearly there.
Did we have chocolate milk? Did Ollie have hot chocolate or did he have chocolate milk? Hot chocolate. Which one did you like better? Did I have a coffee that day? Is that the one we spilled?
Done.
Awesome.
Yay!
I think that's it. It's over, Sammy. That is it over.
Well done,
Right,
we
take
got
the
there.
patient. What do you say?
Thank you.
Yeah, you're welcome. Bye.
Hi, Julie. There's no note on the system, so I think it should be fine. If it was anything, they would have given you a call.
1330.
Yeah? Yeah. Bear with me one moment, please.
No problem. Bye-bye.
I'm not going to read
Is she
those
ringing
to
up
her.
for her test results?
Yeah.
So, because it says provisional, you need to say to her the results are back but haven't been seen yet by a doctor.
Oh, okay. Okay.
You only say it's okay if it says normal, no action.
Normal, no action.
We
Okay.
normally text the patient. So if she
Okay.
hasn't heard by the end of the week, call us back.
Okay. Hello?
Okay. What is your son's date of birth?
I don't know whether you read my report.
Yeah, so you're considering swimmer's itch.
Yeah, well, I've done Dr. Google.
So I've done a bit of
Have you?
CDC Google.
Excellent, that sounds good.
Okay, can I have a look at the rash?
You can, right. Yeah. So it's all over my body now. The worst place
Okay.
is, where it started, was on my arm there. And that was the first to go, so it got all over my back. I think it's going up my neck as well.
Okay.
And it's all over my legs.
Okay.
So it's kind of looking great, don't you think?
Sorry, I'm just... Okay.
Strange, eh?
Did you go in any hot tubs or anything like that?
No.
Okay. So, it's a tricky one because it could be one of quite a few things.
Really? There we go.
So, a small part of me thinks it could look psoriatic, like psoriasis, like something called a guttate psoriasis. Alternatively, it could be something called pityriasis rosea.
Right, okay.
So, I know this sounds all a bit too much, but that is a rash that comes up. They have no idea why it comes up. Yeah. It's one of those we don't know why, but it does, and it tends to go away eventually by itself.
Yeah.
That can take several weeks. And then finally, we have swimmer's itch. And that's a parasitic larva infestation. The larvae usually go on ducks and things like that, but they then get kind of eaten, pooed out by the ducks and end up in the water.
Yeah.
And they don't like to live in humans, but they still try to burrow in us anyway, and it's our own bodies that decide to mount an allergy to it, steroid.
What are you leaning towards?
So, I would recommend, let's treat it as a guttate psoriasis. Yeah. Let's give you the antibiotics for the throat, and let's give you the stronger type of treatment for the rest of you, and hope that it goes away. And if it doesn't, we'll figure it out.
That sounds good.
Okay. But thank you for informing me about that. The thing is, I'm going to overdiagnose it in everyone now. I'm going to be like, you definitely have swimmer's itch.
Yeah.
Okay. Do you want me to send them to the Boots on Clapham High Road, or do you want me to print it out?
Can you print them out? Because I'm heading away for the weekend.
Oh, where are you going?
Back home.
Where's home? I'm just being nosy now.
Oh, right. No,
okay.
Am I right to go out in the sun? Or to
You are actually, interestingly, UV rays are quite good for psoriasis.
Oh, right, okay.
Please be careful about getting burnt.
Yeah, and that could be, I'm sure there's another question, but, oh yeah, how long can it be, will it be until I expect them to kind of
Why
go
don't we
away?
review things in a week's time?
Okay, yeah.
If things are still no better.
So I'll book it, and then if it goes away, then I'll just...
cancel it.
Super, excellent. Thank you very much for that. See you later.
Bye.
How are you anyway?
Yeah, I'm fine. Glad
Looking forward to the weekend.
Oh, you know me too well. I'm glad it's Friday, to be honest.
Oh, yeah. I suppose you'll be out gallivanting, as usual.
What makes you think that?
Oh, got to do it while you're young, haven't you?
Saving all my money. I can't spend it on going out anymore.
They've photographed my retinas again. I've got to go there on the 12th of July, see a nurse, and I'm booked in for 2 operations on my right eye on the 14th of August.
So they're operating, wow.
It's just a
They must need to, but they wouldn't do it, would they?
I've got a retina at the back, which gives me double vision, right? And then they're going to peel that or whatever it is, and they're going to do a cataract on the one day.
Ooh.
I have to go back.
You're going to be awake or asleep? Awake. Oh.
Yeah, it's a day thing. It's only a 6-hour thing. Well, horrible, is it?
I don't know. I've never had one. Thank God.
I'm coming.
Hi, how are you? Sorry to keep you waiting.
You know I don't mind. Most of the time.
So are you able to manage with the paracetamol for this pain at the moment?
Yes, I won't take anything. You know, I don't like them.
You don't like tablets?
No, I don't like the stronger painkillers because they make you feel sick.
So you just want to keep to the simple paracetamol?
Yes. Also, I used to do this home kit thing for bowel cancer.
Oh, yeah?
And I don't don't remember receiving it this year, but I normally do it every 3 years.
Let's have a look. And you are. So December 2014, we sent a letter to you saying that you'd not done it. So let me have a look at that letter.
Yeah, I don't remember receiving the actual...
You probably never got it, which is why you never did it, and then
Yeah.
they just put you on this list, isn't it? Let's have a look. What's happened there? Would you like to do it?
Well, I'm getting quite a bit of blood in the stools.
Yeah.
And I know I've got some haemorrhoids.
Yeah.
So that's not helping.
Yeah.
And it's not just like it's a little tiny bit, it's like it's a great big line of it, if you know what I mean.
So there's a lot of blood. And how long's that been going on?
Oh, a few months now. But I've been putting it all down to my hemorrhoids.
Let me just have a look at the blood thing. Yeah, so your haemoglobin was fine, but that was done quite a while ago.
I hate talking about these things really, but yesterday, there was all little blobs of blood
Yeah.
in it. So I don't know. Because there is cancer in the family.
It's not uncommon for patients to ignore their symptoms, especially if they're worried that the symptoms might be related to cancer. But what I would say is if symptoms do persist, it's really important to make sure that it isn't anything sinister. What cancer in the family is there?
It's the bowel and stomach cancer.
Yeah.
I've lost my mum, my aunt, my 2 sisters.
I mean, if I'm honest, Maureen, we do need to investigate this.
It feels and looks exactly like a sebaceous cyst.
Okay, if it doesn't go away, I'll bring an egg.
You bring an egg.
Egg on your face.
Any change to the colour of your urine? Did that look the same or any difference?
Urine swings from caramel to lemonade.
Okay.
Any other questions?
Joy. Thank you very much.
Okay.
Yeah. Thank you.
Bye-bye. And you.
So from your point of view...
I actually smoke more.
You're smoking more?
Smoking more, yeah.
Oh dear, that's not the direction we want.
I know. They stopped us smoking in my room. So we have to go outside to have a cigarette, and I thought, oh, that's brilliant, I'm going to smoke much less.
So how many do you smoke?
I smoked about 40 a day.
40, that's quite a lot.
Sometimes more.
Okay.
I used to smoke about 200 cigarettes a day, but it's gone down to about 40.
Okay. I mean, all I can say is, what, you're 41 just now, aren't you? Okay. So, no, you're still, sorry. You're still young.
I'm still 21. I'm not
21, sorry.
Still 21.
I misread the screen. You're 21. So it's important, even though you have been smoking for years, it will make a huge, huge difference to your health if you can try and cut down and even stop.
And my dentist, I had to see the dentist today. I've got to go again tomorrow.
Okay.
But my dentist said I could lose my teeth because when the cigarettes puff, the teeth run away from the gums.
So lots and lots of good reasons
This is
to
what
stop.
I talked to Bob about. That's
Yeah. Okay, well, keep at it. Keep persevering.
Yeah.
Okay. And you had some blood tests taken recently when you were here.
They took 3.
They took 3, did they?
And
Okay.
then they took 2 from the closet on the Tuesday before that.
Okay.
So that's 5 in 1 week.
Oh, you had a lot.
A lot, yeah.
So we checked your kidneys, and we checked your liver function, we checked your calcium level, checked your cholesterol, your thyroid, and your blood count, and they were all very good. The only thing is still the diabetes. If there's any other area to target, it's the diabetes.
Right, that's the sugar level, isn't it?
That's the sugar level.
Like chocolate bars and fizzy drinks.
Yeah, and do you have lots of chocolate bars and fizzy drinks?
I do have an odd chocolate bar.
Well, I think that...
I do drink a few fizzy drinks though. I do have fizzy drinks. I drink fizzy drinks.
Okay, well, if you could make one change, that would be a really good one to stop. Why don't we do one thing at a time? I would stop the fizzy drinks, replace it with something else.
This was the first occasion that I had actually met Skip in general practice, although I'm sure she's well known to other doctors in the surgery. She was clearly a delightful, very bubbly character, a lovely person to meet. It's important for her to have a regular doctor, I think, who she knows and she feels comfortable to come and speak to, and I hope that we can provide that service to her. It's always a pleasure to meet somebody like Skip.
Is there anything else you need from us today? Do you need any medicines or anything at all? Looks like you've had them all issued quite recently.
I'm getting a craving. I like cheese and onion sandwiches.
Okay.
Yeah, but I can get that from the shop. I don't need to get that from you. Cheese and onion sandwiches, yeah. You're pretty, you are.
Oh, thank
What's
you.
your
That's very nice of
secret?
you. Oh, I don't know.
You
I don't know.
don't
No
know?
fizzy drinks. That's what it is.
I know why you're saying that.
I think we might need to call it a day.
Yeah, all right, because I can get into things where I will talk.
No, it's lovely to meet
I
you.
talk too much sometimes.
No, it's really.
Yeah. Sometimes I don't shut up.
No, that's fine. I do remember you definitely kindly showed me around your room before one time when I came, so it was really nice of you. And you'd lots of little ornaments, some kind of little ornaments you had above the doorway. I can't remember what they were.
One was a frog.
Could well have been. It was a while ago, so I don't.
One was a dinosaur.
Okay.
Yeah, and I've put some more up now.
Okay.
Yeah, and I've moved things about. Did I show you the homemade curtains?
No, I don't think you did. Next time.
Maybe that wasn't me then, because I've got homemade curtains like this, lots of strips.
Okay.
And then just hang them on top of the thing up there. The curtain there.
That's great. I think
Very
everything's going
colourful.
really well. I think you're doing really, really well.
Okay.
Just go back around the corridor.
And what did you need, sir? Everything?
What cancer in the family is there?
It's the bowel and stomach cancer.
Who's got it in your family or had
Mum,
it?
my aunt, my sister.
Mum, aunt, and sister.
Sister and an uncle.
And have you ever had a colonoscopy?
Yeah.
When did you last have it?
Oh, crikey, we're going back some years now, about a few years back anyway.
Now, the thing I need to do is a rectal examination. You willing to let me do that today?
Yes,
yeah?
of course.
Let me just get this ready. There you go. So I'm just going to put a bit of cold jelly on my finger and see if I can feel any of these piles. Are you eating and drinking normally?
Yes, yes.
And your bowel habit, what's that actually like?
Actually, it keeps, I don't know, one minute it's okay.
It's all right.
I'm not having a lot of, I used to suffer badly with constipation.
Yeah, it's a bit looser, is it?
Yes.
Would you say your bowel habits changed recently?
They have this year.
Yeah, since you've had the bleeding?
Yeah.
Yeah. Okay, I can feel the pile, but I can't feel anything else abnormal. All right?
Don't want to get old. Could you feel any of your piles inside?
I did, but the thing is that doesn't mean that I can say, oh, that's all your bleeding is due to your piles because of your family history. Do you see? So we do still need to refer you for a colonoscopy. I'm going to arrange for you to have a blood test because we just want to see whether you're anemic or not.
Yeah.
And then once I've got that blood test result, I'm going to refer you to the hospital for a colonoscopy to investigate the bleeding.
Yeah.
All right? Because it isn't something that we can just ignore.
No.
I know you've been trying to ignore it,
I know.
but we can't ignore it.
No.